Because the sacroiliac joint, or I'll refer to as the SI joint, is a joint between the sacrum and the hip, it is predominantly a pelvic structure and therefore can be injured during any rapid force that the pelvis sustains. The joint serves to almost transmit the force between the leg and the rest of the body, or between the low back and the leg. So anything that would jar your lower back and then be transmitted to the leg, or any force that would jar your leg and then be transmitted to the back, would go through the sacroiliac joint. So for instance, somebody who's in a car accident and they're the driver and they plant their right leg down on the gas pedal, that force, that ground reaction force that goes to the leg, would be transmitted through the sacroiliac joint, can injure that. Somebody who's chronic low back pain is compensating for that. That could also throw off the sacroiliac joint. In addition, many muscles insert on the sacroiliac joint ligaments, your hamstring muscles, your gluteal muscles, your back extensor. So injuring any of these muscles, even a hamstring strain, can affect the sacroiliac joint as well, and vice versa. Usually patients localize the pain with sacroiliac joint dysfunction to the buttock region. In fact, there's a point, almost a little dimple over the sacrum called the sacral sulcus, and patients can point usually with one finger just to this spot. Pain from the sacroiliac joint can radiate far down the leg. In fact, it can almost mimic sciatica or radiculopathy. Studies have actually put a probe in the sacroiliac joint and map referral patterns of the pain, and it can refer as far distally as below the knee. So I'm concerned that you might have a strain of your lower back, so I'd like to do a physical examination to take a look. Okay. If you could turn around. The first thing we do is just look at the low back region, have you bend forward, and look for any significant curvature of the back, which I do not see. You can stand up straight, great, and lean back towards me. To look at the range of motion, have you stand up straight again, lean to the left side. To check side bending and lead to the other side. Good, and stand up straight, and we'll check trunk rotation and rotate to the left and rotate to the right. Good. From there, I'm going to palpate or touch the bony elements of your spine down the middle. And then we move out to the muscles and feel for any tight bands or knots in this region. Then we move down to the sacroiliac joints in the pelvic area. To evaluate sacroiliac joint dysfunction, the first step is the history, followed by a detailed physical exam. There are many maneuvers that I can perform on the patient that either cause the sacroiliac joint to be more painful or alleviate sacroiliac joint pain. And even though you're provoking the sacroiliac joint, this is very important information. Being that history and physical exam is not specific or sensitive for ruling in or ruling out sacroiliac joint dysfunction, the gold standard is to inject the sacroiliac joint under X-ray guidance and see the response to this. When we perform a sacroiliac joint injection, the relief is usually noticed in the first few days from the anesthetic component. However, the steroid can take several days to take effect, and the injection may last as long as months to a year, and when the pain returns, it may not be as intense. We know that the joint receives its nerve supply by nerves that exit out of the sacrum from holes or foramen, as they're called. And as those nerves branch out of those holes and feed the joint, we can perform a procedure where you put a probe between the hole where the nerve exits and the joint itself and destroy that by creating a tract. Now, this uses thermal energy, where we actually use heat to destroy the nerve. The name of the procedure is called a radiofrequency ablation procedure of the sacroiliac joint. Beyond the injection, other treatment options for sacroiliac joint dysfunction are a combination of either physical therapy or chiropractic care to mobilize the joint or to stretch out the ligaments or reinforce the ligaments around the joint. Medication-wise, we use anti-inflammatories to address the pain in this region. Coordinated Health has two alternative treatments for sacroiliac joint dysfunction that are very effective. One is called prolotherapy. In patients whom the ligaments are too loose around the sacroiliac joint, injecting a sugar water solution into the ligaments can cause some inflammation and tightening of the ligaments and stabilize the joint. Another treatment that we offer is traditional Chinese medicine with acupuncture, as this can very much affect local pain in this region as you address the energy imbalance in channels in the low back and pelvic region.
There are two goals in treating your back pain. The first is to treat your acute pain, and the second is to address the functional limitations that are causing you pain. You can't treat just your symptoms if you don't know what's causing them. Chiropractic care is an important tool in reducing the acute pain, while physical therapy addresses your functional limitations or impairment. But both therapy and chiropractic care are education-based. They focus on your ability to move in all planes as well as to maintain correct posture. Maintaining that correct postural alignment includes keeping your feet straight, your hips tucked in, your shoulders back, and your chin tucked. Individual, comprehensive, progressive physical therapy programs focus on 4 areas. The first is to improve functional core strength. This provides you a firm base so your limbs can generate force and motion. The second is functional stretching. This is to regain or improve the range of motion and flexibility of the muscles in your back in all directions. The third is functional endurance. This is to improve your muscular endurance and your ability to maintain correct postural alignment. And finally, the last area is functional balance and proprioception. This proprioception means improving your ability to maintain balance in all planes. At Coordinated Health, we work as a team in your education and treatment, but you're the key member of that team. Maintaining a pain-free back means working hard to understand and apply the principles which we teach you. Stretching and strengthening your back on a daily basis will help prevent recurrences of back pain, allow you to move better, and improve the quality of your life. And that's the art of medicine.